400,000 babies are born each day worldwide, according to the United Nations. The COVID-19 pandemic is not stopping women from continuing to have them. Some tell us that they were already expecting or had plans to have them before the COVID global crisis erupted. However, others worry about how the decisions to have a child may affect mother and baby, as the current time proves to have some worrisome health and economic challenges. So what does research say about pregnancies and the coronavirus? We explore this and more coming up on today's episode. Hello, I am Auriane Itangishaka. Welcome to Our Voices. On this episode, we discuss maternal health during a pandemic. Doctors know that viruses can affect pregnant women and their developing fetuses, and now they are scrambling to understand the effect of COVID-19 on pregnancies. Carol Pearson explains.
When a woman is pregnant, her immune system changes to protect her growing baby. But these changes make her more vulnerable to certain viruses, such as the flu, and increase her risk of serious health problems. So far, studies about pregnant women infected with the new coronavirus show both reassuring and alarming results.
They had increased hospitalization, and they had increased ICU admission, and they had increased receipt of mechanical ventilation when they compared them to women of the same reproductive age with COVID-19 that were not pregnant.
Doctors are trying to determine if COVID-19 is more dangerous for pregnant women than getting the flu. Yet the Centers for Disease Control and Prevention says pregnant women who get COVID-19 and are hospitalized have higher rates of serious illnesses, are more likely to have miscarriages, deliver babies prematurely, and more likely to have stillborn babies. Other studies contradict these results.
Since COVID-19 is so new, we don't have all of the data that we really need to make an assessment as to what level of risk it imparts on a pregnant woman.
For example, could stress be a factor? Pandemic-related hurdles to prenatal care, like lockdowns, prevented some women from getting checkups.
Take a breath and go right back at it.
Or even getting medical care when giving birth. Some women put off seeing their doctors out of fear of getting the coronavirus.
Prenatal care, particularly in the third trimester, is one of the ways that we ensure both mother's health and ensure that there aren't stillbirths.
Until more is known, pregnant women need to protect themselves from the coronavirus by wearing face masks, social distancing, avoiding crowds, and practicing good hand hygiene. Doctors say women also need to call their physician if they notice decreased fetal movement.
Thanks, Carol, for that report. The fear of getting infected while pregnant is very real for mothers. Somali health authorities said that the number of maternal checkup and childhood vaccinations are plunging during the pandemic, as many people fear catching COVID-19 at clinics and hospitals. Healthcare workers worry the lack of medical care for pregnant women and children could result in a wave of common disease that could take more victims than COVID-19. Mohammed Shiknor reports from Mogadishu.
Amina, Mustaf and her family were displaced by the drought 3 years ago and have since been living in a Mogadishu relief camp. Her 3-week-old baby needed vaccinations, but she was too afraid of catching COVID-19 to go to a clinic.
I couldn't go to a healthcare facility because of this COVID-19. It is spreading across the entire world. I fear for my health and that of my child. We are scared of contracting the virus at a health facility. My child and I have missed important prenatal and postnatal vaccinations, all because of this COVID-19.
Somali health workers are alarmed by the sharp decline in child immunizations and visits to the clinics during the pandemic. Volunteers like Sadia Ahmed are going door to door, urging families to vaccinate their children, but it is no easy task.
Every mother, whether pregnant or lactating, says they are not ready to come to the health facility for vaccination. Most fear contracting COVID-19.
The ICRC says visits to the Somali Red Crescent clinics by children under 5 and pregnant women dropped by more than half in the first 7 months of this year compared to 2019.
COVID-19 has badly affected the entire country and forced mothers and children not to come to health centers for vaccinations in fear of the virus. This fall in vaccinations will result in more and more children contracting contagious diseases.
We have indeed realized vaccination numbers have dramatically dropped due to the emergence of COVID-19. Nonetheless, Somalia's health ministry is exploring new ways to urge people to embrace vaccinations as a way of preventing contagious diseases and reducing child mortality rates.
Flooding around Mogadishu in recent months also risks waterborne disease, warns the ICRC. The floods are further straining Somalia's pandemic-stretched health system and only adding to the worries of mothers like Mustaf. Mohammed for VOA News, Mogadishu.
We're going to take a quick break. When we return, some couples may be intentionally delaying having a baby during this pandemic. Others just didn't plan on having a child during this global health crisis. That is what happened to my colleague Ifyok. I'll explain more after the short break.
Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Welcome back, You With Our Voices. Let's go to Jos, Nigeria. When the worldwide pandemic was declared, my VOA colleague Ifyok Itang's wife was already pregnant. He tells us about that experience.
My wife Nambam and I didn't plan to have a child in the midst of a global pandemic, but we didn't have a choice. The first case of COVID-19 in Nigeria was confirmed in February, when my wife was already 7 months pregnant. Nambam went into labor 3 weeks early. We rushed to the hospital and we're grateful to see few patients in the waiting room. On April 18th, we welcomed Deborah Emewabasi into the world. In Nigeria, a grandmother usually comes to stay with the new parents to help with the baby and the mother's healing after the birth. But with the COVID-19 travel restrictions and both our mothers in the high-risk age range, we have to handle things on our own, including entertaining our 3-year-old son. Despite increasing number of infections, Nigerian authorities on May 4th eased a weeks-long lockdown in major cities, but not in Jos. So I continue to work from home as much as possible to keep my growing family healthy.
I reached out to Ifyok and his wife to find out how they're doing and to learn more about their experience in welcoming their bundle of joy during this pandemic. Take a look.
I'm going to start with you, Ifyok. How worried were you when you realized that there was a global crisis happening, a pandemic? How worried were you for your pregnant wife and new baby?
For me, I'll say just for a lot of uncertainty. Having a child, and my wife was already in the 3rd trimester. And so I think I just had a lot of fears of, what would this mean? Which hospital do we go to? Which hospital can we be sure that, we'll be safe, for this? I think we feared a lot of complications, and so we're just uncertain. I think that's the word we just used to be uncertain of what this will bring.
Now, Ifyok, how about the lockdowns? Was that a hurdle for you in getting the medicine and the food that your wife and baby needed during and after the pregnancy?
I think one of the blessings was essential services were allowed to function, and essential services included, of course, apart from people in the grocery stores and pharmacists and medical personnel. But I say thank God journalists were also allowed to function. And so with a press card, I was able to move around. I think the only problem was the scarcity of some of the medical supplies. There's always a list which she's given to bring to the hospital some medical supplies to come with to the hospital when it's time for to give birth. And I think at some point we went around from pharmacist to pharmacist to pharmacist trying to find a specific medical supply, and it was very hard to get it. I think we actually just went to the hospital hoping that while she's there, somebody else can run around and still go and check and find before the whole process is over. Yes. So
now I'm going to turn to you, Mrs. Itang. Now, how was your pregnancy and delivery experience during this pandemic overall?
Okay, I would say my pregnancy this time was different from the first because this time around I had to wear my mask. I had to be extra careful going to the hospitals because I had fears and I wasn't sure about the sanitary level of the hospital. So I had to be careful, kept social distance. And for the delivery went well. I had my husband around and had my mother-in-law and my mom. They were all there. And fortunately for me, on arriving the hospital, there were fewer patients there. And so I wasn't as anxious I wasn't afraid. And I progressed in labor and the baby came.
How was your postpartum care for you and baby? Were you worried about going in and out of facilities, hospitals, clinics? Were you worried about you and your baby contracting COVID-19?
Yeah, for my postpartum care, I didn't enjoy some privileges I had the last time. Because here in Nigeria, when a woman puts to bed, she either goes to her mom's house or the mom comes over to her house. And so I didn't enjoy all of that because I had to just stay home with my husband, and he helped around take care of our son. I helped around take care of the baby, and also for the hospitals. Yes, I had I gave her all the vaccines she needed to get, but while going for those vaccines, I had fears because I felt I knew for sure there was a pandemic, but some people here felt it was all cooked up by the government, and they felt it wasn't real because other sicknesses are taking people down here much more than the COVID-19. So, I had to be extra careful. I had to put my sanitizers everywhere around and just be extra careful in the hospitals. But I sure gave her all the vaccines I needed to.
So what advice do you have for pregnant women at this time during this pandemic? What should they do?
Okay, I would say they could avoid crowded areas for now. They could be careful and take all the precautionary measures that they have been outlined for them to take so they could keep the baby safe and themselves safe too.
Now, if you had to choose back then or even now, would you still decide to have a baby despite the pandemic?
Yes, I will, because she gives me lots of joy and she's just been a blessing to us. So I will.
You still have another one?
Yeah.
Well, guys, thank you so much for being with me. And of course, thank you to baby Deborah for participating and being with us. I appreciate it. Thank you.
Oh, she said thank you.
Thank you so much.
Thank you very much.
Are you worried about your health and that of your child during this health crisis? In the Democratic Republic of Congo, some mothers also face being locked up in the hospitals for not paying their delivery bills and being trapped in an environment where both mother and baby could easily contract COVID-19. Anastasia Tudiesh reports from Kinshasa.
Mama Maziba Maternity Referral Health Center is a public health facility serving some of Kinshasa's poorest residents. Nearly 80 babies a month are born in the maternity center here. But when mothers cannot pay their bills, they are not allowed to leave. 21-year-old Bellonie gave birth to her first child, Erika, during the coronavirus confinement.
They told us it would be a boy, so we did put aside the $35 needed. Then they told us they would do a C-section, so there were additional fees.
Bellonie's husband installs cable television, but the confinement has left him without work, and the family is struggling to gather the $250 needed for the hospital bill. Until they pay, Bellonie and baby Erica are not going home. Michelline Lleko, too, is stuck at the hospital.
When I arrived to give birth, I had nothing. They eventually agreed to take care of me, but I had to discuss it a lot. I really had to beg.
Michelline gave birth to her third child, Marveline, and now cannot pay the $50 bill. She says she understands why she and other mothers are not allowed to leave.
They check up on us. That is the way of the world. Money fixes everything.
Dr. Eric Masina is director of the health center.
Go back home? How, my dear? There are people who have done the work. Some drugs that have been used. Medicines we have used. Many things we have used. And who is going to pay for that if we let them go?
C'est une situation qu'on a toujours déplorée.
This is a blatant human rights violation. Detaining an individual for default of payment, especially a woman, is violating the law.
C'est violer les droits.
Attorney Elodie Ntimire Muzigirwa is a patients' rights advocate who says Congolese authorities must do more to help new mothers.
The Minister of Health visited a few facilities and made sure that some detained women were discharged. But that only happened while he was present. That is not the goal. That is not the ideal way of dealing with such an issue. He said those measures would be effective in all health facilities, in both Kinshasa and in the provinces. It never happened.
Dr. Masina says he's sympathetic to the economic situation, but for women who cannot afford to give birth, it is an issue of family planning.
There is no way one can stop these ladies from giving birth. Simply impossible. They need guidance. However, we advise and encourage them to use birth control. For the poorest, we provide the birth control. It is not mandatory. It is their life after all. We simply try to help them choose to rest, say, 5 years and improve their socioeconomic status so they can come back and deliver without these problems.
Attorney Elodie Muzigirwa says Congo's health ministry recognizes the problem and the work she's doing with the United Nations to boost patients' rights. It is not about changing some laws, but more about rebuilding Congolese healthcare, she says, as new mothers stuck in hospitals are symptoms of a sick system. Anastasie Tudièche for VOA News, Kinshasa.
Thanks, Anastasie Tudièche. For most people, bringing a child to work at a hospital will seem like a poor choice during the COVID-19 pandemic. But many expecting mothers in the medical field have little to no choice if they are to keep their jobs. VOA Arashad Arabasadi tells us about a pregnant doctor in California who's caring for patients with COVID-19 with her unborn baby.
While many parents are home with their children during the coronavirus pandemic, Dr. Zafia Anklesaria brings hers to work. 7 months pregnant with a son, she co-directs an intensive care unit, or ICU, in Los Angeles.
He's really well behaved in the sense that when I'm doing the procedures, he's chilling. He doesn't give me any trouble. He just lies still. That would be really inconvenient if I was doing an intubation and I suddenly felt a pretty aggressive kick in there. I'd be like, oop.
Anklesaria says she and her colleagues felt a sense of duty when the pandemic broke out. She researched the risks to her baby and determined that with personal protective equipment, or PPE, they would likely both remain healthy. Her concern now is what happens after birth.
I'm worried that he's not going to have the ability to develop close relationships with family and friends because we're going to have to keep distance from everybody.
During long days surrounded by patients facing serious health issues, Anklesaria calls decompression a critical part of her routine.
We don't have a lot of time to process feelings around here. We speak to families on the phone about their loved ones dying, and it is very difficult. And after that, if I wasn't pregnant, I would have a lot of wine, but I can't do that.
Anklesaria says she and her husband have yet to decide on a name, and despite her friends asking, she will not be naming her child Corona, Coronalita, or COVID. Arash Arabasadi, VOA News, Washington.
It's time for another quick break. But first, are you planning to have a baby despite the COVID-19 pandemic? If you are, visit us on Instagram and tell us about your thought process. Our handle there and on Facebook is @VOA Our Voices. You can also send us a message on WhatsApp. Our number is right there on your screen. Now, many people have lost their source of income during this pandemic, and it's causing obstacles in their family planning. We'll look how some are overcoming those challenges. That's after the break. Stay with us. Now let's go to Tanzania, where a pregnant woman lost her job due to COVID-19. Makeup artist Mary Mwihava was delighted to learn that she will be welcoming a new child into the world. But when she lost her job during the pandemic, she was forced to tap into her creative talents to find inventive ways to feed her family. A report by Barbara Santos and Unali.
Hiki kipindi kinanitisha sana.
I am terrified of this coronavirus pandemic. My biggest fear is that I don't know if my child will be safe when the time of delivering comes. Sometimes I even wish to quit clinic, but I can't. I have to track my child's health. I was at home when my boss texted and told me to stop working when we started hearing about COVID-19. Frankly, it was very difficult to hear the message. Life has become harder ever since I stopped working, especially under the coronavirus. My husband and I are the only ones feeding the entire family, but we lost our jobs and we're all staying at home now. We need to survive. My kids need to eat, and they don't understand when there is no food. Since our savings are running out, we've had to change the whole system of food. We are now cooking half of what we were eating, so we can sustain ourselves during this hard time, as we don't know when the pandemic will end. I have always loved working, and I really miss my job. My job has a huge contribution to my family, my life, and especially during my pregnancy. Without it, we can't survive. After all the schools were closed due to the coronavirus, my brother-in-law created a schoolwork schedule for the kids. They have time to study, to pray, to watch TV and cartoons. And we make sure they review their schoolwork. Every time after I finish eating, my kids like to play with my baby. They like it when they see the baby kicking. They wish to see their younger brother soon. I don't regret getting pregnant at this time. I'm praying to God to keep me safe. I don't know what tomorrow holds. I don't know when the situation will end.
na hali yenyewe sijui inaisha lini. Kwa bado naiwazia sana.
I'm still thinking of my tomorrow. I wish it could end now so that I can get back to my hustle, so we can all get back to normal.
Na maisha mengine yaendelee ili tuweze kuzisaidia familia zetu.
As we wrap up this week's show, we want to share with you the story of a woman working to improve maternal health care for disadvantaged women in Senegal. Khadidiatou Nakoulima is the founder and CEO of the Senegalese Maternity Clinic. Alison Lleko Fernandez tells us more about her from Dakar, Senegal. In the popular district of HLM Grand Médine in Dakar, Khadidiatou Nakoulima founded this medical center. Engineer and graduate of the prestigious École de Mines in Paris, Khadidiatou grew up in a family of medical doctors in Senegal and very early on was aware of issues related to maternal health in a country with a two-tier health system.
We decided to create Nest as a response to the need of the middle-class populations who aspire to better quality of care, but because they cannot afford it or do not have insurance, are not able to access them.
A project developed together with her brother was inspired by the Indian models of a chain of social hospitals. Khadidiatou even spent 3 months in India in an immersion program in their local clinics. Her project became of interest to the INP, funds dedicated to promote small and medium-sized African enterprises, supported by the European Investment Bank. It was finalized in 2011 with the opening of a pediatric medical platform and then in 2013 with a maternity hospital.
All our teams work on every process, from patient receptions to hospitalizations, and even to patient follow-up after that, in order to meet their highest expectations.
In 2018, the clinic obtained an ISO 9001 certification, which rewards the management system. Florence Sambou is responsible for the nursery. Her experience here is different from her previous jobs.
Yes, before I came from another clinic and there was so much stress and pressure there. You had to do the medical care and billing. Here at least you only focus on the medical care and that's all. We take care of the baby, just the baby.
Khadidiatou now aims to expand her structure, particularly through partnerships with the public sector. And that's all for us this week. On behalf of my colleagues here at VOA, thanks for being with us. Until next time, have a wonderful day.